Hello and welcome to the Breakpoint Risk Management Training on Wildfire Smoke Protection. Today we will work on building an understanding of the health effects of wildfire smoke. We will discuss acquiring and understanding the Current Air Quality Index. We will review Title 8, Section 5144, Requirements Regarding Respiratory Protection, and how it goes hand in hand with wildfire smoke. We will also discuss implementing a two-way communication system and effectively protecting employees from wildfire smoke. Most of what's known about the hazards of wildfire smoke has to do with particulate matter, the tiny bits of solids and liquids in polluted air, as the wildfires are especially good at producing particles in a size range that can be dangerous to health. It isn't clear yet if what fuels wildfire smoke, be it vegetation, a mix of trees and structures, or other human-made sources, affects the toxicity of particulate matter. Smoke from wildfires contains chemicals, gases, and fine particles that can harm health. The greatest hazard comes from breathing fine particles in the air, which can reduce lung function, worsen asthma, and other existing heart and lung conditions, and cause coughing, wheezing, and difficulty breathing. The smallest and usually most harmful particulate matter is called PM 2.5 and includes solid particles and liquid droplets suspended in the air with an aerodynamic diameter of 2.5 micrometers or smaller. Wildfire smoke is a complex mixture of gases and particles that is similar to cigarette smoke but without the nicotine. The precise chemical makeup of the smoke varies by fire as it depends on the type of fuel burned, including structures, intensity of the fire, atmospheric mixing, and distance or age of smoke, but generally speaking, it's a mix of carbon dioxide, carbon monoxide, nitrogen oxides, particulate matter, fine of course, hydrocarbons, and other organic compounds. However, fine particulate matter, or PM 2.5, is what we are primarily concerned about when we consider impacts on health. These particles are 2.5 micrometers across or smaller, or about 1/30th the width of a human hair. While not everyone has the same sensitivity to wildfire smoke, it's still a good idea to avoid breathing smoke if you can help it, because even someone who is healthy can get sick if there's enough smoke in the air. Anyone can experience burning eyes, a runny nose, cough, phlegm, wheezing, and difficulty breathing, and if you have heart or lung disease, smoke may make your symptoms worse. People with heart disease might experience chest pain, palpitations, shortness of breath, or fatigue, and those with lung disease may not be able to breathe as deeply or as vigorously as usual, and may experience symptoms such as coughing, phlegm, chest discomfort, wheezing, and shortness of breath. Hospital visits for lung care go up during wildfires compared to periods without them, especially for asthma and chronic obstructive pulmonary disease. There's evidence of increased trips to the hospital for cardiovascular health problems during wildfires as well. Now, there isn't much known about the long-term effects of the health risks from wildfire smoke, but some studies have been conducted provide clues to what may be in the cards. One study looked at the effects of the 1997 wildfires that scorched large areas of Indonesia. It found that 10 years later, population-wide, males and the elderly were worse off in 2007 for health measures such as lung function. In another study, researchers looked at the wildfire smoke that plagued the Seeley Lake community of Montana in 2017, which has parallels to the prolonged hazardous exposures happening now in California and the western United States. found that from July 31st to September 18th of that year, the daily average level of PM 2.5 was 221 micrograms per cubic meter of air. The research team screened adults throughout the Sealy Lake community right after the last day of increased smoke, and 2 more times in each of the following 2 years. Compared to the same levels of smoke, the participants from the Sealy Lake area had poorer lung function 1 and 2 years out. The researchers had expected to see people affected worse right after and were surprised to find that there was a bit of a delayed response. Some people are more at risk when it comes to wildfire smoke, and we briefly discussed a couple of them on our last slide, but it's especially important to pay attention to local air quality reports during a fire if you are a person with heart or lung disease, such as heart failure, angina, ischemic heart disease, emphysema, or asthma, are an adult who is older, which makes you more likely to have heart or lung disease than younger people, are caring for children, including teenagers, because their respiratory systems are still developing, they breathe more air and air pollution per body pound of body weight than adults. They're more likely to be active outdoors, and they're more likely to have asthma. Are a person with diabetes, because you may be more likely to have an underlying cardiovascular disease. And are pregnant women, because there could be potential health effects for both you and the developing fetus. High concentrations of smoke can trigger a range of symptoms. Anyone exposed to wildfire smoke may experience burning eyes, a runny nose, cough, phlegm, wheezing, and difficulty breathing. If you have heart or lung disease, smoke may make your symptoms worse. People with heart disease might experience chest pain, palpitations, shortness of breath, or fatigue. People with lung disease may not be able to breathe as deeply or as vigorously as usual, and may experience symptoms such as coughing, phlegm, chest discomfort, wheezing, and shortness of breath. Employers must allow employees who show signs of injury or illness due to wildfire smoke exposure to seek medical treatment and may not punish affected employees for seeking such treatment. Employers must also have effective provisions made in advance for prompt medical treatment of employees in the event of a serious injury or illness caused by wildfire smoke exposure. If an employee experiences a hoarse voice, difficulty breathing, prolonged coughing spells, or mental confusion, they should seek medical attention. The decision of whether to call an ambulance for assistance should be made, as someone with smoke inhalation can get worse quickly, and by transporting such a person via private vehicle can lead to significant injury or even death, which can be avoided if the individual is transported by emergency medical services. A number of tests or procedures may be performed depending on the severity of the signs and symptoms being experienced. Chest x-rays may be performed if the patient has respiratory complaints. The initial chest x-ray may be normal despite significant signs and symptoms, but a repeat chest x-ray may be necessary during an observation period to determine if delayed lung injury is occurring. Blood tests may be conducted to determine if there are enough red blood cells to carry oxygen, enough white blood cells to fight infection, and enough platelets to ensure clotting can occur. They may also look at the changes to the blood pH, which may identify an interference with oxygen diffusion, transport, or use. For individuals with significant respiratory distress, acute mental status changes, or shock, they will also have their arterial blood gas obtained, which may help the doctor to determine the degree of oxygen shortage. The most important part of smoke inhalation treatment is oxygen, and in most cases can be administered through a mask or nose tube, depending on the severity of the symptoms. Certain medications can be used to treat symptoms of smoke inhalation, such as bronchodilators, which work to relax lung muscles and widen airways. Antibiotics may be given to treat or prevent an infection, and other medications may be necessary. If your exposure is severe, you may also have carbon monoxide poisoning and may require hyperbaric oxygenation, where you're placed in a compression chamber and given high doses of oxygen. The oxygen dissolves into the blood plasma so your tissues can receive oxygen while the carbon monoxide is removed from your blood. If symptoms are mild, at-home treatment prescribed by a doctor may consist of getting plenty of rest, sleeping in an inclined position to help you breathe easier, to avoid smoking or secondhand smoke, and to avoid things that may irritate your lungs, such as extremely cold, hot, humid, or dry air. They may even prescribe breathing exercises for you to perform, also known as bronchial hygiene therapy. The Air Quality Index, or AQI, is the Environmental Protection Agency's, or EPA's, tool for communicating daily air quality. Think of the AQI as a yardstick that runs from 0 to 500. The higher the AQI value, the greater the level of air pollution and the greater the health concern. An AQI valued at or below 100 is generally thought of as satisfactory. When AQI values are above 100, air quality is unhealthy. At first for certain sensitive groups of people, then for everyone as AQI values get higher. The ozone AQI covers an 8-hour time frame, while the particulate pollution AQI covers a 24-hour time frame. The AQI is divided into 6 categories, and each one corresponds to a different level of health concern. Each category also has a specific color, making it easy for people to quickly determine whether air quality is reaching unhealthy levels in their communities. The EPA establishes an AQI for 5 major air pollutants regulated by the Clean Air Act, including ground level ozone, particle pollution, also known as particulate matter, including PM 2.5 and PM 10, carbon monoxide, sulfur dioxide, and nitrogen dioxide. Each of these pollutants has a national air quality standard set by the EPA to protect public health. The AQI for each pollutant is generally based on the health-based National Ambient Air Quality Standard for that pollutant and the specific information that supports that standard. Employers are required to determine employee exposure to PM 2.5 for worksites covered by Title 8, Section 5141.1. At the start of each shift and periodically thereafter as needed. This can be accomplished by checking the AQI forecasts and current AQI for PM 2.5 by viewing the website of or using another effective method, such as telephone, email, text, etc., from the U.S. Environmental Protection Agency, or EPA, the U.S. Forest Service, the Interagency Wildland Fire Air Quality Response Program, the California Air Resources Board, or local air pollution control or air quality management districts. You also have the option of measuring current PM 2.5 levels with a direct reading instrument, provided it is done so according to the requirements found in Appendix A of this section of the regulation. The AQI forecasts usually are issued in the afternoon for the next day. For ozone, an AQI forecast focuses on the period during the day when the average 8-hour ozone concentrations are expected to be the highest. For particulate matter, the forecast predicts the average 24-hour concentration for the next day. This allows you to understand which groups of people may be affected by the AQI and to identify the steps individuals can take to reduce their exposure to air pollution. By using the AQI forecasts, you can plan your outdoor activities for the day. Much like a weather forecast lets you know whether to pack an umbrella, an AQI forecast lets you know when you may want to change your outdoor activities to reduce the amount of air pollution you breathe in. Some areas do issue AQI forecasts for several days to help you plan, but things can change, so it's a good idea to check the forecast every day. While knowing where to find the AQI information on the web is important, there are also some mobile resources that can assist you while away from your computer. For instance, the EPA's Air Now app, which provides a simple interface allowing users to quickly check current and forecasted air quality information for planning daily activities and protecting the health of yourself and your employees. The app allows users to get location-specific reports on current air quality and air quality forecasts for both ozone and fine particulate pollution. Air quality maps provide visual depictions of current and forecasted air quality nationwide. Another app available is Breezometer, which can send custom alerts for air quality, weather, and fire alerts. It is known for real-time air quality maps, fire alerts, and daily information for multiple pollens as well. Some other apps out there include Air Visual, Plume Labs, and Air Matters, to name a few, and all of them are available for both Android and iOS. For large job sites, taking advantage of the Air Quality Flag program could be a great way to help keep all of your employees informed of the current air quality in the area. The Air Quality Flag program uses brightly colored flags to help a community or workplace be aware of daily air quality conditions. The flag colors correspond to the colors used in the EPA's Air Quality Index. The purpose of the program is to help people continue to exercise and work outside while protecting their health when the air quality is unhealthy. Via the Air Quality Flag Program's website, you can download many different resources, including fact sheets, posters, guidelines for outdoor activities when the air is unhealthy, and even a widget you can add to your website that will always show the AQI on your homepage. Cal OSHA Title 8, Section 5141 addresses protection from wildfire smoke. It directly applies to workplaces where the current AQI for PM 2.5 is 151 or greater, and the employer reasonably anticipates the employees may be exposed. The employer is responsible for determining employee exposure at the start of each shift and periodically thereafter as needed. The employer is also responsible for establishing and implementing a system to effectively communicate wildfire smoke hazards in a language and manner readily understandable by employees. It is important to encourage employees to inform their employer of wildfire smoke hazards at the worksite without fear of reprisal. Effective training shall be provided to all employees in a language and manner readily understandable by everyone. Finally, the employer must control employee exposure to harmful levels of PM 2.5, utilizing engineering controls, administrative controls, or respiratory protection. Simply put, employees who work outdoors or in a location that does not have mechanical air filtration and may be exposed to a PM 2.5 AQI of 151 or greater for more than 1 hour during the shift must be provided with the current AQI before and periodically during each shift, documented training, work modifications to reduce exposure, and respirators with encouragement and instructions on how to use them. There are some workplaces and operations that are exempt from this regulation. They include enclosed buildings or structures where the air is filtered by a mechanical ventilation system and windows, doors, bays, and other openings are kept closed to minimize contamination by outdoor or unfiltered air. Enclosed vehicles with a cabin air filter and windows, doors, and other openings are kept closed to minimize contamination by outdoor or unfiltered air. Where employees are exposed to a current AQI of PM 2.5 of 151 or greater for a total of 1 hour or less per shift, and firefighters engaged in wildland firefighting. As stated on the previous slide, employers are required to train employees in a language and manner readily understandable by everyone. Employees shall be provided training on the health effects of wildfire smoke, the right to obtain medical treatment without fear of reprisal, how employees can obtain the current air quality index for PM 2.5, the requirements of Title 8, Section 5141.1, the employer's two-way communication system, the employer's methods for protecting employees from wildfire smoke, the importance, limitations, and benefits of using a respirator when exposed to wildfire smoke, and how to properly put on and use respirators provided by the employer. Employers should reduce the employee exposure to PM 2.5 to less than a current AQI of 151 using engineering controls whenever feasible. This can be done by providing enclosed buildings, structures, or vehicles where the air is filtered. If that is not sufficient to reduce exposure to PM 2.5 to less than a current AQI of 151, then reduce exposure to the extent feasible. Examples of other engineering controls that may be implemented include installation of filtered mechanical ventilation systems, installation of higher efficiency filters, installation of air purifiers or air scrubbers, reducing the amount of outside air administered by the ventilation system, and ensuring building pressure is positive relative to the outside. When engineering controls are not feasible or do not reduce exposure of PM 2.5 to less than a current AQI of 151, you should implement administrative controls when practicable. This can be done by relocating work to locations where the AQI for PM 2.5 is lower, changing work schedules, reducing physical intensity of work, postponing outdoor work, or providing additional rest periods. Respirators can be an effective way to protect employee health by reducing exposure to wildfire smoke when they are properly selected and worn. Surgical masks or other items worn over the nose and mouth, such as scarves, t-shirts, and bandanas, do not provide protection against wildfire smoke. A NIOSH certified filtering face piece respirator is the minimum level of respiratory protection allowed for wildfire smoke. Filtering face piece respirators, such as N95s, will not protect the user against gases, chemical vapors, oxygen-deficient atmospheres, or highly toxic minerals. When the current AQI for PM 2.5 is equal or greater than 151, but does not exceed 500, the employer shall provide sufficient respirators to all employees for voluntary use and encourage employees to use them. They shall be NIOSH approved and effectively protect the wearers from inhalation of PM 2.5, such as N95 face piece respirators. The respirators being used shall be cleaned or replaced as appropriate, stored and maintained so that they do not present a health hazard to others. Where the PM 2.5 is greater than 500, respirator use is required and shall be used in accordance with Title 8, Section 5144, and the employer shall provide respirators with an assigned protection factor score that the PM 2.5 levels inside the respirator correspond to an AQI less than 151. Respirators must be used properly and replaced if they become damaged, deformed, dirty, or difficult to breathe through. Filtering facepiece respirators, such as N95s, are disposable and cannot be cleaned or disinfected and should be replaced at the beginning of each shift. If you have symptoms such as difficulty breathing, dizziness, or nausea, go to an area with cleaner air, remove your respirator, and notify your supervisor or get medical help as needed. When wearing a respirator, the following precautions must be taken. Only respirators certified by NIOSH for protection against particulates should be used. A label or statement of certification should appear on the respirator or respirator packaging. Read and follow the manufacturer's instructions on the respirator's use, maintenance, cleaning, and care, along with any warnings regarding the respirator's limitations. Do not wear respirators in areas where the air contains contaminants for which the respirator is not designed. Individuals should keep track of their respirators so that they do not mistakenly use someone else's respirator. And talk to your doctor if you have heart or lung problems before wearing a respirator. Let's discuss how to properly don a respirator. Before putting on or taking off a respirator, you should always wash your hands thoroughly. If you have used a respirator before that fit you, use the same make and model and size. Inspect the respirator for damage, and if it appears to have any damage, do not use it. Ensure that you do not allow any facial hair, jewelry, glasses, clothing, or anything else to prevent a proper placement or come between your face and the respirator. First, you will want to position the respirator in your hands with the nosepiece at your fingertips. Cup the respirator in your hand, allowing the headbands to hang below your hand. Hold the respirator under your chin with the nosepiece up. The top strap goes over and rests at the back of your head. The bottom strap is positioned around the neck below the ears. Do not crisscross the straps. Place your fingertips from both hands at the top of the metal nose clip, if present. Slide your fingertips down both sides of the metal strip to mold the nose area to the shape of your nose. Once you have donned your respirator, you need to check the seal to ensure it properly protects you during use. To check your respirator, You'll start with placing both hands over the respirator and taking a quick breath in to check whether the respirator seals tightly to the face. Next, you will place both hands completely over the respirator and exhale. If you feel leakage, there is not a proper seal. If air leaks around the nose, adjust the nose piece as described during the donning process. If air leaks at the mask edges, readjust the straps along the sides of your head until a proper seal is achieved. If you cannot achieve a proper seal due to air leakage, ask for help or try a different size or model respirator. Once you've used your respirator, you need to properly remove it. Do not touch the front of the respirator as it may be contaminated. Remove the respirator by pulling the bottom strap over the back of the head, followed by the top strap. Without touching the respirator, discard the used respirator in a waste container and immediately wash your hands. It's important to maintain consistent communication with employees during wildfire smoke events in a language and manner readily understandable by all. Ensure employees are informed of the current AQI and steps they should take to reduce their exposure. Employees must also be encouraged to provide feedback and report worsening air quality or adverse symptoms of smoke exposure without fear of reprisal. Wildfire smoke can be dangerous to everyone, but some people are at higher risk of severe effects. Title 8, Section 5141.1 requires that you work to protect your employees from the risk of wildfire smoke exposure, that the air quality index is monitored on an ongoing basis to ensure any hazardous conditions are identified as quickly as possible. Any changes to the AQI or in response to an increase in hazardous PM 2.5 levels should be communicated to your employees clearly and effectively through a two-way communication program that encourages employees to speak up about worsening air quality or any symptoms they may be experiencing. Controlling the harmful exposures employees face is important, whether through engineering or administrative controls, or through the use of respirators to help protect everyone from the effects wildfire smoke can pose. Ensuring employees are properly trained to identify those hazards, the health effects of wildfire smoke, how to obtain the current AQI, what protective methods are in place, and the importance, use, and limitations of respirators can make all the difference in how you and your employees work together when wildfire smoke is a risk to everyone.